Good morning, Sri Lanka. You're with me, Amaya, and it's a Monday morning, which means that we're now ready for our segment on pain management with Dr. Namal Senasinghe, of course. Good morning, Doctor.
Good morning, Amaya.
How are you this morning?
Fine.
Enjoying, yeah. Yes. And today, if you have been watching the show regularly, you would know that we've been covering back pain in our initial episodes, and today we're going to revisit the same pain because the response we got for that was overwhelming, and there are still some aspects that we need to cover about certain types of back pain, and also more specifically the treatment for back pain. So today we'll be speaking about interventional treatments, isn't it, Doctor?
Yes.
So what do we mean by interventional treatment?
Interventional treatment is that as pain medicine consultants, we do perform quite a number of procedures. For the layman, it's injection, but it's not a simple injection. We do all our procedures under X-ray guidance, and also we use dye in the sense contrast, and we take pictures, and all my patients will get a printout. And even Sri Lanka, so it's...
Is this your policy?
Yes, of course. If you do inject, you need to give a printout because it has to be quite transparent what we do. And the patient should have that, and then whenever the patient goes to see another doctor, he can provide the evidence what he's had. Most patients tend to forget what they had. So if any doctor, going through the procedure, the pictures will recognize what the patient has had.
I see.
So that's the mainstay, and also the patients who come to see us, at least I would think 90% have back pains. So in a clinic, if I see 20 patients, around 16, 17 or even 18 will have back pain. So that's the commonest cause. As I told you, 5 million days of work being lost per year in UK. The burden to the economy is huge due to the high funding available for back pain, which is $1 billion sterling pounds. As I told you last time, is more than the budget in Sri Lanka.
Wow.
So injections, we'll get on to the injections.
Sure.
I will start from top to bottom. The back, when you say back, when it comes, it is from the neck down to the bottom, to the coccyx. So this is the cervical spine. There are seven vertebrae there, and we tend to do, depending on the problem they have, one of the commonest things is the facet joint injections. If there is facet joint arthropathy, we do inject the facet joints under X-ray.
The facet joint is the joint between the vertebrae, or
the facet joint is the joint that keeps the vertebrae together. So it's like a few levels of brick. One vertebrae lies on the other one, and the thing that keeps together is the joint. Right, is the knee joint, keeps the lower leg and the upper leg together, so something like that.
Yes.
So you inject the facet joints, and then if they have a good response, we can do a permanent therapy, which is called radiofrequency denervation. So you heat up the small nerve that supplies the facet joint by a current, and then using probes, and then that will give long-term pain relief. Okay, and then the other thing is you can do a cervical epidural for any disc prolapses. And then you put a dye in, and then you put the drugs in, and then you give a printout to the patients with all this. And also you can do root blocks for disc problems. And
what is the root block?
Root block is, now these are nerve, the yellow ones are nerve roots. Yeah, so nerve roots are coming out from the spinal cord. So every nerve root supplies a specific area.
Yes.
So let's say if there is a disc problem at C5 level, which is the fifth cervical vertebrae, if it's on the right side, you tend to do a block on the right C5 root. So if he's got pain going down shooting down the arm, so these are all different interventions in that area. Okay, and also you can, for shoulder pains, I tend to do something called suprascapular nerve block. You block the nerve that supplies the shoulder, and then if they have a good response, we can heat the nerve it's called pulse radiofrequency. You don't kill the nerve because the patient loses the feeling, but you heat it up to 42 degrees centigrade, and it'll inhibit the pain pathway. So that's called a suprascapular pulse radiofrequency. So
keeping some warm compresses on your back, that is also some way that people relieve the back pain as well, isn't it?
Yeah, that's warm. That's, as I told you last time, but that's counter irritation. That's what happens.
It's a different method.
That's the method, yeah.
Oh, okay.
So this is pain. Pain can be, it's count irritation, and then that reduces the pain.
I see.
Okay? And also then in the thoracic spine, you can do the same thing, thoracic epidurals, facet injections, okay? Facet injection, these are the facet joints, and then you can do the root blocks. Problems with thoracic spine is not that common. Main problem is in the lower back and the cervical spine, because they are that is the part of the spine which turns and moves, yeah? So then you come to the bottom of the spine, which is lumbosacral. Very common problems do occur in this area. And then what we can do is we can do epidurals, dye. When you put a dye and take a picture, it's an epidurogram. Okay? Similar to a myelogram where you put the dye into the intrathecal space, which is the spinal fluid. But here you put into the epidural space. And then you get a picture, and then you can say whether the disc is pressing on the nerves and whether there is blockage or tightening of the nerves.
And this picture can be a guide whenever you go for consultation.
Yeah, of course, yeah,
right?
yeah.
Yes.
So you can you do the epidurals. Caudal is coming. Caudal in Latin is bottom, coming from the bottom of the spine. Or you can do lumbar steroid epidurals. Root blocks can be done. Facet injections, and also radio frequency. And also you can, for people who had, as I told you, failed back surgical syndrome, you can put a guide wire from here, which is called a Rax catheter. R-A-C-E-Z. Rax is the person who invented this, and I met Rax personally, actually, in America, and says that I've seen him doing that to my own eyes. So you put a Rax catheter here, and then you break all the adhesions due to surgery, and then you put other chemicals as well, drugs, and then that's called a Rax catheter. And then the final thing is the spinal cord. The more serious stuff, high-tech stuff, is we're offering that as well in Sri Lanka, actually. It's called spinal cord stimulator, where you put a catheter, you put two electrodes, and then pass it onto the spine, and then you can stimulate that. You've got a special motor embedded under the skin, right? And then you have a remote control. Patients who have pains, especially in the legs, you can stimulate whenever they get a pain, stimulate the electrode with a remote.
But if I can ask at this point, doctor, is this a very invasive surgery? Because I'm sure the viewers are concerned about how much of it you will be cut open.
No, we don't cut. That's the thing. Because in my technique, the neurosurgeons can do that. They cut up. I don't use scalpels or cutting. So here we put big needles. Yeah, patient is quite semi-conscious or anesthetized, and then you put the needles in, and through those needles you pass the guide wire. So I don't think it's that invasive, but it's a high-tech, it's called neuromodulation techniques, yeah? So then you pass this, and I'm hoping to offer this in Sri Lanka. Actually, I'm trying to get some patients from abroad as well. We can do cheaper here than in England. Probably the costs are, in England it costs a lot of money. And then here it's about half the price. So, we might have a market here. We talk about medical tourism, but I haven't seen, other than Maldivians, anybody else coming from the West to get treated here, but probably that's something. But maybe
Sri Lanka can become a hub.
Of course, yes. Yeah. If you can offer, and I'll talk to when I get back, I'll talk to the NHS and see. And this is called a spinal cord stimulator. It's high-end technique, and then I will offer that to Sri Lankans in the future.
That's very good news for all Sri Lankans, isn't it? And I'm sure our viewers are very happy to hear that as well. So I think we have to wrap up a discussion on interventional treatment for back pain today. But thank you so much, doctor, for being here with us today. And just to remind you again about how you can contact Dr. Namal. His direct number here in Sri Lanka is 0779 838 450. 0779 838 450, and you'll be able to contact his secretary here in Sri Lanka. So thank you so much, doctor, for being here with us today.
Thank you very much. It was a great honor coming here, and I really enjoyed these interviews. And I'm going to share this with all my staff in the UK.
And I hope they enjoy it as well.
My secretary was quite excited after seeing that.
Is it?
Yeah.
That's great to hear. So we enjoyed it. We hope you enjoyed it, Sri Lanka, and have a good morning.